Welcome back. Now, the Merck Foundation is a pioneering philanthropic organization committed to improving the health and well-being of people around the world. Now, through strategic partnerships and collaboration with governments, NGOs, academia, and other stakeholders, the foundation implements programs and initiatives that empowers healthcare professionals, strengthening healthcare systems, and advances medical research and education. Now, our producer on desk, Dennis Manuel, had one-on-one engagement with Senator Dr. Rash Kelej, the CEO of the Merck Foundation, and Professor Frank Staggenberg-Heinkemper, the chairman of the Merck Foundation Board of Trustees, as they came to Namibia for a two-day visit. Now, let's take a look at their conversation.
The Merck Foundation expand professional capabilities in healthcare research and media, improve access to innovative and equitable healthcare solutions, empower women and youth in education with a special focus on science, technology, engineering, and mathematics. Professor Frank Staggenberg, the chairman of Merck Foundation Board of Trustees, emphasized more on the aims and objectives of the foundation.
There are several aspects to it. It is a philanthropic program of the Merck Group, but totally unrelated to that. So we are working independently of the Merck Group. The main aim is really to improve the social and the health well-being of population in developing countries. So we do it with several means. One mean is, of course, that we support sponsorships for doctors to specialize in specialties where they haven't been trained in yet, for example, oncology or fertility, reproductive medicine, and so on. The aim is really to help to improve the medical care in the country, because medical care is very much important if you want to also have social development and economic development. The basics are having a healthy population who can rely on the medical system. And of course, the next thing is also to help establish certain standards for African women. That's very close to our hearts. I think my colleague Dr. Rasha will tell you more about that. And of course also to further the education of young pupils, particularly girls, to give them a better start in life and a better opportunity to fulfill their dreams, what they ever want to do.
Awesome. The foundation established a partnership with the Office of the former First Lady, Madam Monica Gengos, in 2020, on which the two parties have worked together on countless projects, of which health and academics is no exception. Senator Dr. Raja Kelej, the CEO for Merck Foundation, pointed out a number of these projects.
Merck Foundation established in 2017, but we started our program since 2012 under corporate social responsibility strategy. And the main objective is to build healthcare capacity in public sector and transform patient care across developing countries, mainly in Africa, but also in some countries in Asia and Latin America. So we provided more than 1,700 scholarships for doctors from 52 countries. So in 42 critical and underserved specialties like diabetes, hypertension, oncology, cardiovascular preventive, sexual and reproductive care, fertility care, embryology, respiratory care, pediatric emergency, actually many specialties. We know that there is a lack of a specialist in Namibia, in many, in all across Namibia, especially in the public sector, from local Namibian doctors. So we were very much focusing with Her Excellency the First Lady of Namibia and the Medical Society of Namibia to focus on local Namibian doctors who's working in the public sector, who's young, and mainly we focus on women because we believe very much in women empowerment. If you are here today, you will see that majority, more than 95%, are women female doctors, which is very important for our also mandate as women empowerment. So you've seen building healthcare capacity, women empowerment. Also we build support girls education, which is very important for us as well, and breaking the stigma of infertility through More Than a Mother campaign, which is our signature campaign.
You have been working with the former First Lady of the
Yes.
Republic of Namibia.
Yes.
Can you just kindly tell us examples of partnership, collaboration that you've established?
We worked really nicely with Her Excellency, the former First Lady. She was full of passion for Namibian and to add value for Namibia. We started our work in 2020. And the main objective we were working on, breaking the stigma of infertility and empowering infertile women and fertile couples through access to information, healthcare, and a change of mindset, like breaking the stigma and all this. Supporting girls' education, and most importantly, building healthcare capacity and provide scholarships of 1-year diploma and 2-year master degree to Namibian young doctor, local doctor from the public sector. We were very much aiming to establish a strong platform of specialists in Namibia.
Awesome. Let's now take it out of Namibia. You have been assisting countries across Africa.
Yes.
Approximately
52 countries, yes.
Okay, the figure is correct. Now, what impact has the Merck Foundation had on the global health outcome?
I think the effect we had is undeniable. It doesn't need even to measure. When I tell you that we provided the specialty training on specialists, first specialists in many specialties in Africa, and when we started in 2012, there was no one oncologist in Chad, Niger, Burundi, Sierra Leone, Gambia, Congo, many countries, like no even single oncologist. We trained the first oncologists in many of these countries. We didn't have fertility specialists. We didn't have embryologists. And then there is other specialties like for example, emergency, pediatric emergency, orthopedic and emergency. All these things is very, very needed, and we trained. In Namibia itself, we trained the first specialists in the public sector in many fields, as you heard today. One of them, for example, orthopedic emergency, pediatric emergency, ICU, respiratory care. Dr. Josephine Augustine was the first oncologist that we trained from Namibia in the public sector. So it was really needed, and the impact is huge, and we have a very big milestone. More than 1,700 scholarships being provided to doctors from 52 countries. It's a huge transformation.
So you strictly work, okay, let me not use strictly, but mostly you work with offices of the First Lady.
Yes.
In various countries.
Offices of the First Ladies as ambassadors. They are ambassador of Merck Foundation More Than a Mother. And also we work with ministries of health and medical societies of each country we are working in, yes.
Okay, now my question is, what criteria can, let me say for organizations, that the NGOs that want to attain assistance from the Merck Foundation, what criteria do they follow? Do you follow
We don't differentiate, as Dr. Frank said, between any countries. We work directly with the government. We don't work through organizations, but we work through the government and the First Lady office, because the government and the First Lady office or the Ministry of Health, they are the only one who knows the gaps and the needs in the public sector.
The Merck Foundation have initiated various innovation technicalities to embrace technology, of which media awards, musical awards, and fashion awards makes part of the few innovations.
We have innovated a lot of initiatives, like for example the media awards and the fashion awards and the film awards and the music awards. All this is to engage the young people and the youth and the creative people, talents in many of these fields, to be part of the raising awareness, be the voice of the voiceless, and break the silence about very critical issues like breaking the stigma of fertility, supporting girls' education, ending child marriage, stopping FGM, stopping GBV, all this, and also raising awareness about diabetes prevention and early detection, hypertension as well, and promoting healthy lifestyle. So we have 8 awards that we are promoting every year. So everyone can apply, and from here I'm calling for application for all the media from Namibia to apply for these awards. It's very prestigious awards, and the present is very important. We have also the fashion awards and the music award. I know there is a lot of musicians here. We worked with Shanke before, and a very important song called 1, 2, 3 ABC about education, and he is a very Namibian artist, like talented. We want to work with more. So this is the innovation comes here, talents, using talents and working with them, multi-sectoral.
Okay, it's quite evident your work is out there, you can see it.
However, how does the Merck Foundation measure the effectiveness of these programs?
Through a summit like this, you came here, we gathered the testimonies and the post-training impact of each doctor we provided the scholarship for. And through also our application we receive for the awards and see the engagement of the people, and through our social media followers, which is more than 5 million followers from Africa. So the engagement, the request, the partnership with the First Ladies across Africa, the engagement of the partners and our engagement in the fields and visits to African countries all the time. We see and we measure our impact every day. Every day actually we see it. We are very happy with it.